Hello and namaste to all of you. This is Name-Shalu Singh from Department of Physiotherapy and Diagnostics from Jayoti Vidyapeeth, Women's University. For today's topic, I'll be talking with you about Bence-Jones proteinuria. So, before knowing Bence-Jones proteinuria, let's see what is Bence-Jones protein. So, Bence-Jones protein is a monoclonal globulin protein or immunoglobulin light chain found in the urine. So immunoglobulin, first of all, you would might be knowing it is your antibodies. So the structure of antibodies has heavy chain and light chain. So these Bence-Jones proteins are monoclonal globulin protein or immunoglobulin light chains, which are found in urine. So with a molecular weight 22 to 24 kilodalton, the detection of Bence-Jones proteins may be suggestive of multiple myeloma, Waldenstrom's macroglobulinemia, Bence-Jones proteins, they are particularly diagnostic of multiple myeloma in context of target organ manifestations such as kidney failure, lytic or punched out bone lesions, anemia, or large number of plasma cells in bone marrow of patients. Bence-Jones proteins are present in 2/3 of multiple myeloma cases. So the proteins are immunoglobulin light chains or are paraproteins and are produced by neoplastic plasma cells, and they can be kappa, so most of the time, or lambda. So these are the types of your heavy and light chain, kappa and your lambda. So the light chains, they can be immunoglobulin fragments or single homogeneous immunoglobulins, and they can be found in urine as a result of decreased kidney filtration capabilities due to kidney failure, and sometimes induced by hypercalcemia from the calcium released as bones are destroyed from light chains themselves. So the light chains are historically being detected by heating a urine specimen, which causes the protein to precipitate, and now by electrophoresis of concentrated urine. Now, more recently, serum-free light chain assays have been utilized in a number of published studies which have indicated superiority over the urine test, and particularly for patients producing low levels of monoclonal free light chains, and as seen in non-secretory multiple myeloma and AL amyloidosis. Now, Bence-Jones proteins was described by English physician Henry Bence-Jones, after which this protein has been named in 1847, and it was published in 1848. Now, this Bence-Jones protein in urine test is used most often to diagnose the check of on multiple myeloma, which is a type of cancer. So, or an abnormal Bence-Jones protein test may mean you have a type of malignant lymphoma, and there are cancers of lymphatic system, and multiple myeloma is a type of blood cancer that affects your plasma cells. Now, these are the immune system cells that make antibodies to fight infections. So, most plasma cells live in bone marrow. So, multiple myeloma, these tumors are often found in bone, and bone marrow is where blood cells are made. Now, multiple myeloma takes up space and leaves less space for normal bone marrow, and this can cause problems such as anemia, and this is not enough red blood cells. It can lead to weakness and tiredness, and thrombocytopenia. This is not enough blood. Thrombocytopenia means not enough blood platelets called thrombocytes, and there are needs for from a blood clots, and this causes excess bleeding or bruising. And the term leukopenia means not enough white blood cells, and it can lead to weakening of immune system. So healthy plasma cells are not just one kind of blood cells affected by multiple myeloma. So the myeloma tumors also make monoclonal antibodies, and monoclonal means they are all of one kind, and this makes them ineffective and even harmful and they do not fight infections, and they can also damage the kidneys. And the monoclonal antibodies are made of two types of proteins, and Bence-Jones proteins are of one type. So these proteins show up in urine in many people with multiple myeloma, and myeloma cells can make chemical signals that tell osteoclasts to work a lot. The osteoclasts are cells that break down bone, and because of this, multiple myeloma can weaken bones and cause breaks. So the broken down of bones can also lead to higher levels of calcium in blood. High blood calcium or hypercalcemia can cause many problems, and these include thirst, excess urination, uh, to dehydration, and kidney problems. So, in rare cases, um, now that osteoclasts, as I told you, that osteoclasts are cells that break down bone, and because of this multiple myeloma, myeloma can weaken bones and cause breaks. So the breakdown of bone can also lead to higher levels of calcium in blood. So high blood calcium, that is hypercalcemia, can cause many problems. And so uh, hypercalcemia can cause many problems. These include from thirst, excess urination to dehydration, and kidney problems. And in rare cases, this may cause coma. So Bence-Jones protein will also be in urine if you have monoclonal gammopathy of undetermined significance, which is MGUS. And with this condition, your plasma cells make more of one kind of antibody than they should, but they don't form a tumor or make enough antibodies to do damage. And MGUS don't generally need treatment. And but if you have MGUS, you are at higher risk of multiple myeloma, and you are also at higher risk of lymphoma, which is a cancer affecting white blood cells, and you are also at risk of amyloidosis. So this is built up for certain proteins in tissues, and for these reasons, you should be watched by a healthcare provider. Now, what do one need for this test? So you may need this test if you so for reasons why one should need get this test done, or when one would need to get this test done, is that number one, if bone pain or break during bone pains or bone breaks, especially in back, hip, or skull. So secondly, in case of high blood calcium, or in low levels of red or white blood cells or platelets, nervous system problems such as pain, numbness, or weakness, strokes like symptoms such as confusion, dizziness, weakness, and swelling of legs, and a lot of infections. And others tests, what could be the other test that one has to get done along with this test is the diagnosis of multiple myeloma is often done with a series of tests, and you may also have a test such as PVC, that is complete blood count, to check the number of red blood cells, white blood cells, platelets in your blood. Secondly, you can be asked to then the chemistry profile. So to check the levels of albumin, blood urea nitrogen, calcium, creatinine, lactate dehydrogenase. And these levels can give information about kidney function and how multiple myeloma has spread. And beta 2 microglobulinemia and CRP, that is C-reactive protein, to check the levels of protein and help show how multiple myeloma has spread. Nextly, quantitative immunoglobulin testing to check the levels of different kinds of antibodies. Serum protein electrophoresis, that is SPEP, to check the levels of proteins in blood. And this test can detect M proteins. And M protein is another name for a large number of abnormal monoclonal antibodies. Immunofixation electrophoresis, which is IAP. So this test is done to look at proteins that come from abnormal antibodies. Next is your electrophoresis and immunoelectrophoresis of concentrated urine. So both these tests are one other's ways of finding a monoclonal protein in the urine. So you may also have tests done such as imaging tests. So X-rays can be used to check bone damage. So other tests such as MRIs, CTCs, or PETs may be used to look at bones for damage and also to see the number and size of myeloma tumors. Nextly, bone marrow biopsies. So a small amount of bone marrow is taken with a needle and the bone marrow cells are checked in a lab for signs of multiple myeloma. So what do the test result basically mean or how to read your test result? So test result may be depending on your age, gender, your health history, the method used for the test and other things. Your test result may not mean you have a problem. You can ask your healthcare provider what your test results mean for you. So Bence proteins are not usually in urine. So Bence proteins in urine, they can be a sign of multiple myeloma or another rare condition called Waldenstrom macroglobulinemia. And about 50% to 80% of people with multiple myeloma have Bence proteins in their urine. So if you have been diagnosed with multiple myeloma, a Bence protein urine level, it can be used as one of several ways to find out the stage of cancer. And stage of cancer means how much has it grown and spread. And the other factors used in staging are your calcium levels, hemoglobin levels, and X-ray findings. So now Bence proteins are also found in some people with lymphoma. So how is this then a test done basically? So this test may be done with a 24-hour urine sample. So for this sample, you must collect all your urine for 24 hours and empty your bladder completely, and which is the first thing in the morning without collecting it. Note the time, then collect your urine every time you go to bathroom for over the next 24 hours. So you will collect it in a container that your healthcare provider or lab has given you. Or you may have urine protein electrophoresis, which is UPEP. So this checks the level of protein in urine, including Bence proteins. And this test will not require a 24-hour sample. So it is done with a small sample of urine in a collection cup. So, so this test does not pose any risk. And if your healthcare provider uses a test strip to look for Bence proteins, the strip may not detect them. So the best way to find these proteins is to use electrophoresis or immunoassay. And also talk with your healthcare provider to find out if any medicines you are taking might affect your test results. So, and for the test, you need to prepare, and but be sure your healthcare provider knows all your medicines. If you're taking any, your herbs, your vitamins, and supplements you might be taking. So these includes medicines that don't need a prescription or any illegal drugs you may use. So be sure to inform your physician about every thing or your medical history. So this was all about Bence-Jones proteinuria. And if you have any doubts related to the topic, so be sure to contact. And until then, take care.